John, is it?
Yes.
Hi, I'm Shanae. I'm the nurse looking after you. How are you today?
I'm pretty good, yeah.
That's good. I was just hoping I'd be able to ask you some questions regarding your patient history, what's brought you in today, just so we can get a better idea of who you are.
Yeah, sure.
Alright, so just before we get started, I just want to confirm we have the right patient with us.
Yeah.
So could you just confirm your name and your age for me, please?
I am John Krasinski and I'm 65 years old.
Okay, John, and what do you do with yourself?
I am a beauty therapist.
Okay, very nice. And do you have your own business?
I do.
Your own business? Right.
Pretty
How long
unique.
have you been doing that for?
I have been doing that for about 30 years now,
30 years?
Yeah.
Okay.
give or take.
Right. And John, do you have any family or who you live with?
I am divorced, but I have a son who doesn't live with me, but
Okay.
I see him regularly.
Right. So how old is your son?
He's 26 and he's a tradie.
He's a tradie.
Yes.
Okay. Right. And will he be able to pick you up from the hospital after you've had your procedures?
Yes, he said he might be a little bit late, just with how work's going, but...
Okay,
so
no worries, that's okay.
Yeah.
Alright. So I'm just gonna ask you, what brought you into the hospital?
I had a pain in my right hand.
Okay. Right hand. Right. And were you having anything done at the hospital?
Yes, I had surgery for carpal tunnel.
Carpal tunnel. And that was your right hand?
Yes.
Perfect, thank you. Right. Was there any symptoms or events that led up to you coming in to get that checked out?
No specific events, but just like day in day I'd have random pains in my hand.
Okay, so just
picking
pain?
stuff up. Yeah, sharp pains.
Sharp pains, okay. And how long were you experiencing those?
It was on and off for about 2-3 weeks, yeah.
2 to 3 weeks, okay. And were you taking anything to manage the pain? Any Panadol, Nurofen, things like that?
No, I didn't think it was necessary. I would just wait till the pain would go away.
Okay, no worries. Right. And John, do you have any allergies that we should know about?
I am allergic to shellfish. I'm not sure if that'll be any problems, but
Alright.
yeah, I'm allergic to shellfish.
And what sort of reaction do you have?
I puff up and go red and swell up.
Alright, so anaphylaxis?
Yes, that's it.
Alright, and do you have an EpiPen with you?
Most days I do. I keep it in my car or whatever bag I have, but I didn't think it was necessary in the hospital.
Okay, that's okay. Alright. Are you taking any medication at the moment?
Not at the moment, but I do smoke regularly.
Alright, so
About 5 a day, maybe.
alright, so how long have you been smoking for?
Since I was 13.
Okay, and 5 a day since you were 13?
Yes.
No worries. Alright, and do you have any previous medical history that we should know about? Any illness, injuries?
None that I can think of. I broke my arm when I was like really young, like when a
Okay.
young boy fell off my bike, but
Which arm was that one?
that was on my left arm.
Left arm?
Yeah.
Okay.
So I'm not sure if that'll have anything to do with it.
Alright, and did that heal okay?
Yeah.
Yeah.
It was in a cast for a week and people signed it, but yes, it healed.
Oh, that's
Just
good.
fine.
Alright, have you eaten anything today?
I had a coffee and a sandwich this morning in bed.
Coffee and a sandwich?
Yep.
Okay. Right, and this question is a bit more personal, but we do have to ask.
Okay.
Have you gone to the toilet today?
Yes, I went to the bathroom after I had my coffee and my sandwich.
Okay, and did you urinate?
Yes, I urinated.
Anything else while you were in there?
No. Just,
No. Okay.
Just a boring average trip to the toilet.
Okay. And did you need any help doing that after your surgery, or were you able to do that on your own?
No, I had full function of everything. I could do it all by myself.
Okay, no worries. Alright, so I think we've answered all of the questions. Alright. The doctor should be in shortly, but I just want to ask, are you experiencing any pain at the moment?
I have a numb feeling in my hand and a little bit down my arm, but
Yep. So it's a numb feeling.
yeah, no pain, just sort of numb.
Okay. And did you want me to get you anything for when I come back, or?
No, I should be okay.
Okay. Perfect. Well, thank you.
Thank you.
Alright, so this is the part of the video where we talk about feedback. So things I could have done better, things I've done well, and then we'll sort of talk about a few ways that I could improve.
Okay.
Alright.
Are you ready to receive feedback?
Yes.
Cool. Good.
So I guess the first thing we'll talk about is things I've done well.
Yep.
So I think when I was asking the questions, I think I got all the information that I needed. I think that the way I asked the questions was okay. Like, I didn't seem too forward or too invasive, I guess. And yeah, I think my posture was okay. I tried to make it seem like I was listening to you and was interested in what you were saying while getting the information that I needed.
Yeah, from my perspective, you were very calming. You came in, when you asked the questions, it didn't feel too intrusive. Like when you asked me, like, these are a bit more personal questions. Have you gone to the toilet, stuff like that? That felt like you were worried about the stuff you were asking me.
Yeah.
Like you weren't just gonna ask me, have you gone to the toilet today?
Yeah.
Yeah.
Okay.
Yep.
Alright. Was that all? Like, was there anything else? Or?
I'm trying to think.
It's okay if there's not.
No, there was other stuff, but I'm trying to think. Yeah, mainly just the way you asked the questions was pretty, like, it had a nice flow to it.
Yeah.
Like, that didn't feel very scripted a lot of the time.
Yeah.
When you were, like, the way you went through the questions.
Okay.
Like, you'd ask me about, like, my medical history and then, like, who I
Yeah.
live with. Like, it all sort of flowed
I
together.
tried to make it flow. I tried to ask them in ways that I thought it wouldn't seem to, like I was reading off something.
I thought that was pretty good.
Alright, so I guess we'll move on to things I could improve on, or things that I didn't do well.
Yeah.
I think maybe just making the conversation flow a bit better. I did try, but sometimes I feel like when I asked the question, it was just a bit random, or it seemed a bit didn't flow as well as I would have liked it to.
Yeah, when I was trying to make conversation, it felt, there was a few times where you gave me a bit of a robotic answer back.
Okay.
And the one time you cut me off as well, that came to mind.
Okay.
But like overall, like it was only a few times where I'd ask you something, or like you'd ask me something and I'd give you a jokey answer back, and
Yeah.
then I just get like the next question instead of
Okay.
a response.
Yeah.
Yeah.
Okay, so I guess now we'll just try and talk about some ways I could improve on that.
Yep.
Um,
An action plan.
yeah, some things I could do, I guess. So maybe trying to.
Just slow it down a little bit more. Not like how you're speaking, just like take more time listening to what the patient is saying.
Yeah.
So like even if it's just like a jokey thing, just like sort of respond, make
Yeah.
it feel like conversation other than like him getting asked questions.
So I'll try to make it seem more like a conversation and less like me asking actual questions.
Yeah, more casual.
Okay. And yeah, I guess I'll just try and be a bit more attentive, I guess, to what you were saying, and
Yeah.
letting you finish before I move on to
Yeah,
the
yeah.
next question.
That was just a one-time sort of thing where you cut me off. But
Yeah.
yeah.
I guess as well as practicing, I guess it will help me improve.